Hello and welcome to our presentation. We are Hannah, Dani, and I'm Drea, and we are doing community paramedicine in Oklahoma, expanding healthcare services beyond emergency response.
The first thing we want to start off with are some key terms in healthcare that are especially relevant in rural areas. Let's start with the definition of rural areas. Rural areas are regions that are sparsely populated and characterized by low population density, smaller towns and agriculture or natural landscapes. Often these are distant from large urban centers and may have limited access to healthcare facilities. One solution is to challenge this community, paramedicine. The definition of community paramedicine is a healthcare delivery model where paramedics provide primary care, preventative care, and chronic disease management in the community. This allows patients to receive care without needing to travel a long distance to a hospital or clinic. The next definition is non-emergency medical care. It is defined by an important concept in rural healthcare areas. This includes routine checkups, medication management, and other healthcare services that do not require emergency treatment. In rural areas, non-emergency medical care often can provide in the home or through telehealth, reducing the need for patients to travel to healthcare facilities. The next definition is chronic disease management. It is a crucial in rural areas where many patients have limited access to specialties or chronic disease management programs, and community paramedicine can play a key role in managing chronic diseases such as diabetes, hypertension, and heart disease, helping patients to stay healthy and avoid hospitalizations. Rural healthcare delivery requires innovation solutions such as community paramedicine, non-emergency medical, and chronic disease management. Healthcare in a community and leveraging telehealth technologies, we can ensure that all patients, regardless of their location, have high quality access to healthcare. How much the data and statistics, according to the Oklahoma Office of Rural Health, the state's rural population is generally older, poorer, and sicker than the state's urban population. This means that people living in the rural areas are more likely to suffer from chronic diseases such as diabetes, heart disease, and obesity. These conditions can have a significant impact on the overall health and the population. Unfortunately, rural health hospitals in Oklahoma have been closing at an alarming rate. In recent years, since 2010, rural hospitals in the state have closed, leaving many rural residents without nearby access to medical care. This is a major concern for all of the health and well-being of the rural population, as it can be difficult for them to receive the medical attention they need. The closure of these hospitals can be attributed to several factors such as declining population, low reimbursement rates, and a shortage of healthcare professionals in rural areas. This has resulted in many rural residents having to travel long distances to receive medical care, which can be challenging and expensive. The health disparities between rural and urban populations in Oklahoma are a cause of concern. With the closure of rural hospitals, it is important to address the challenges that rural residents face in accessing medical care. This is a map of medically underserved areas and populations within Oklahoma. Oklahoma is known for its large rural population, with over 50% of the state's residents living in rural areas. Unfortunately, these areas are often face unique health challenges compared to urban areas. For instance, rural communities tend to have fewer healthcare resources, less access to specialty, and a higher prevalence of chronic diseases like diabetes. In Oklahoma, rural residents are more likely to be uninsured or underinsured compared to urban counterparts. In fact, over 20% of the rural residents in Oklahoma lack healthcare insurance, which can make it difficult for them to access necessary medical attention. The statistics on rural health in Oklahoma highlight the unique challenges faced by rural communities. These challenges require targeted solutions that address the specific needs of rural residents by prioritizing rural health and investing in resources to address these challenges. We can work towards improving the health outcomes and the quality of life for all Oklahomans. The problem. There are several challenges facing rural healthcare in Oklahoma, including a shortage of healthcare, as mentioned before, limited access to specialized medical care, and high chronic rates diseases among rural residents. However, paramedicine can play a crucial role in addressing some of these challenges and improving rural healthcare outcomes. One way paramedicine can help is by expanding access to emergency medical care in many rural areas. The nearest hospital may be miles away, and response times for emergency services can be longer than in urban areas. Paramedics can help bridge this gap by providing emergency medical care in the field, allowing patients to receive treatment more quickly and potentially reducing morbidity rates and mortality rates. Another way paramedicine can help this is by providing preventative care and chronic disease management. Rural residents often have limited access to primary care providers, which can result in untreated or poorly managed chronic diseases. Paramedics can also provide screening measures such as blood pressure screenings, diabetes management, and medication management to help patients manage their chronic conditions and prevent complications. Lastly, paramedicine can help address the shortage of healthcare professionals in rural areas. Many rural communities struggle to attract and retain healthcare providers, as mentioned before. And they can provide a career path for individuals interested in healthcare, allowing them to work and provide essential services within their local community. Overall, paramedicine has the potential to be effective and a solution for some challenges facing in the rural healthcare of Oklahoma by expanding access to emergency care, providing preventative care, and chronic disease management.
Awesome. So now we are getting to the point where we're talking about what this has to do with Healthy People 2030. And Healthy People 2030 is actually published by the Centers for Disease Control, the CDC, and it was published in 2020, outlining multiple areas of goals that they have for our nation and our communities in the United States. And there are a few things that is correlating between paramedicine and Healthy People 2030, which is, by improving rural health, we can improve all health. Increasing the number of people who receive these preventative services will give them a longer and better quality of life that they have. These screenings can be such as cancer screenings, vaccinations, blood pressure checks. All of them are very vital. And reducing the number of individuals who are currently experiencing food insecurity and nutrition can also be very beneficial, and that is in Healthy People 2030. Decreasing the prevalence of chronic diseases such as diabetes and heart disease, as well as improving mental health outcomes and reducing the number of individuals who are experiencing mental health disorders. It's so important that no matter where you are located, that there is access to these services. And if the access is not there, then we need to bring those services to the community. And through paramedicine, we are going to be able to achieve a lot of these goals that our nation has for us. Next, I'm going to talk about some barriers and some challenges that come along with wanting to implement paramedicine in rural communities. The first one would be funding. One of the biggest barriers to implementing community medicine programs is the lack of funding that EMS might not have in order to run those programs to help train those individuals that will be out in the communities. The second one would be regulations. There might be regulations that limit the range of practices for the paramedics or require additional training or certification for them to provide those services in that community. Third is opposition from stakeholders, whether those stakeholders are physicians, hospitalists, or other healthcare providers. Fourth, political resistance. Policymakers may be resistant to the change due to special interests, lack of interest, money, and so much more. Logistical issues, require the development of new protocols and procedures, which you will need collaboration of many people in order to carry that out. Patient acceptance is another barrier. You can have these programs, but you need the community members are the ones who are receiving these programs. And so you want a program that they will accept and be happy with and want to utilize. And lastly would be language barriers. Patients who speak languages other than English may face barriers that the rest of others don't experience to not only understanding, but being able to participate in these programs and having access to them. Now, do not fear, there are many programs that are supported by policy. Listed are a few behind me, like the Oklahoma State Department of Health Community Paramedicine Program, the Oklahoma Emergency Medical Services Act, which actually was able to authorize EMS workers to provide non-emergent medical care and preventative services. One more that I'll mention is the Oklahoma Department of Mental Health and Substance Abuse Services Community Paramedicine Program. There are many programs. I would just love to see them grow even more. Potential policies that are needing to be considered, would be mandating that all EMS providers in Oklahoma have the option to provide community paramedicine services and to receive certification for doing so. Also, establishing statewide reimbursement rate for community paramedicine services. One more would be to require insurance companies to cover community paramedicine services provided by these workers.
Okay, so as you heard Drea and Hannah explain throughout this presentation, rural areas are considered countryside places with fewer than 2,500 residents. Rural areas are in desperate need of paramedicine and access to healthcare. So paramedicine would allow for routine checkups, treatment for chronic diseases, and a decrease in mental health and other health disparities that rural areas are facing. Some steps that you can take with you along with us. We would advise that you talk to your family and peers about paramedicine and this overall healthcare issue in rural areas. If you know someone who is a paramedic, send them some encouragement because they are great hard workers that get taken for granted. Another one is if you go to rural healthcare, this might be a topic that you want to do more research on. I think I speak for our whole group when I say that this research project started as an idea and it spiraled into something that we are very passionate about and want to advocate the importance of what paramedicine is. Another one is to reach out to your representatives and tell them you would like to see more being done on this topic. As we have been in our public health courses, we are understanding that our policymakers work for us. We pay their bills. They are supposed to be advocating for our voices. So if you want to see something done in rural areas, like you saw on our map, Oklahoma is majority rural area, email, call, go up to the Capitol. They would love to hear from you. Last but not least, reach out to journalists who are reporting on topics like rural communities and community paramedicine. Journalists are another great outlet to expand your voice if it's not being heard. So get in contact with them. I know like news reporters, there's some, probably next door neighbor is a journalist. So just communicate and make your voice heard. And here are some references.
Thank you so much for listening.
Bye.
Bye.